video we want to look at cardiac poisons. This is a topic under forensic medicine. So just pay attention here. Cardiac poisons are poisonous plants. Okay, we're talking about poisonous plants, it seems. Only plants. Action mainly is on heart, either directly on the heart or through the nerves. Okay, the important ones here are aconite. Okay, aconite, that is this root, aconite root. Can you see this? This is the aconite root. Okay, and then you have the Cerebra thevetica. Which is Cerebra thevetica? This one, right? This yellow flower. This yellow flower is Cerebra thevetica. This yellow flower, Cerebra thevetica. Then you have Nerium odorum. Nerium odorum in Kannada we actually call it as Kannagala kaddi. This one. This is Kannagala kaddi. This is Nerium. Can you imagine? It is a cardiac poison. We used to grow so much of this when I was a kid, and we used to always take these flowers for worship. So I didn't know that it is Nerium odorum is actually a cardiac poison. This one, Nerium odorum. Okay. Then you have Digitalis purpura. Digitalis purpura is this one, purple one. Digitalis purpura. Just look at it in detail. So if you see it somewhere, you can identify. Actually, it gives a. Isn't it supposed to give a medicine also? No idea. The Nicotiana-Debacle. They have written as tabacum, so we'll tell tabacum only. This is Nicotiana-Debacle. Interesting, right? It looks really cute. So these are the cardiac poisons. So first, you have to name them. Okay. So name them. Name them, guys. Let's put a new slide here for a blank slide so that you can recollect. Done. Okay, so basically, can you tell the cardiac poisons? Aconite, Cerebra thevetica, Nerium odorum, Digitalis purpura, Nicotiana-Debacle. So we will show you some photo. Let's see if you will be able to identify. Okay, this one. Cardiac poison. Identify this one. This is Digitalis purpurea. Very good. This one, Cerebra thevetica. Very good. This one, Nerium odorum. Very good. This one, Nicotiana-Debacle. Aconite, this one. Aconite, actually we have already had a separate video on aconite root, right? Aconite root, we have already finished a separate video. So anyways, this is coming from Acotinum plant. This is the root. Basically the root, you can see it will be tapered. Like you can see this one, it is tapered. Cut section is white. After some time it will become pink. All the parts of the plant are actually poisonous, and it is actually found in Himalayas. The root is very potent poison. Okay, and the taste is bitter, sweet. It is odorless, and it gives offensive odor when it is put in oil. Main thing what you have to notice here, just 2 to 5 milligram of aconite is actually fatal dose. Okay. Then one more thing you have to note here is 1 gram. Okay, not that. Okay, leave that. So 2 to 5 milligram of aconite is actually fatal dose. It kills within a few hours, guys. It kills within a few hours. Then what and all you should know are the active ingredients. Active principles are aconitine, then pseudo-aconitine. So all these active principles we already saw, right? Then other things about aconite root, basically it is cardiac, right? So it causes cardiac effects. Other than that, you will be writing a lot of normal things: nausea, vomiting, burning sensation, dry mouth, tingling, numbness all over the body. Actually, just if the leaf of this plant or the root, okay, it comes in contact with you, it will cause tingling and numbness. Okay, convulsions it will cause, then cardiac effects it will cause. Even the pollen grains of this plant to the eye, they will cause pain and swelling. Okay, there's something called here as in aconite root, and there is a problem caused as hippus it will cause. Hippus basically is nothing but pupil. Alternately it will contract and dilate, so and finally it will only dilate. This is without any external stimulus. This is spasmodic alternate contraction abnormalities. So this is called as hippus. What is it called as, guys? Aconite root will cause what is called as hippus. Okay, then how will you treat aconite root poisoning? Basically, you will give there is gastric lavage, etc., etc. Basically, you will give oxygen. Obviously, oxygen you will give. Atropine you will give. Then you will give digitalis, because you're trying to counter the depressive action on heart. Then you'll give lidocaine, procainamide, and phenytoin. All these you can give to counter the cardiac arrhythmias. Okay. Post-mortem findings: if a person has taken this and he has died, then basically you will not find anything specific, but there will be asphyxia. Asphyxia will be there, right? Then congested stomach, brain, lungs, liver, etc. You might, in the stomach, you might be able to find the remains of the root inside the stomach. Okay. Now, medico-legal importance of this is it can be homicidal poisoning, right? It can be a homicidal poisoning, accidental poisoning, suicidal poisoning, right? It can be arrow poison and cattle poison. This much you have to write in the exam. Aconite root they will use for arrow poisoning. Okay. Now let us move on to Cerebra thevetica. Cerebra thevetica is this one. See, this is Cerebra thevetica, right? Thevetia. Cerebra Cerbera. Oh my God, Cerbera thevetia. I was telling the name wrong all the time. Cerebra thevetia. Please say it again. Cerebra thevetia. Okay. Now this one, again, all parts of the plant are poisonous. The active principle here is thevetin. What is the active principle here? Active principle is thevetin. Active principle is thevetin. Okay. Then thevitoxin. Thevotoxin. Okay. And Cerberin. Okay, thevetin, thevotoxin, and cerberin, and also you have peruvoside, which you may not remember in the exam. So based on the name, you remember. If this is called as Cerebra thevetica, then see, thevetia, right? Thevetia is the name of the plant. So the toxins active principles are thevetin, thevotoxin, and the other one is the C, that is cerberin. Okay, cerberin. The other one is the peruvoside. Now fatal dose is 8 to 10 seeds. If you take 8 to 10 seeds, fatal dose 8 to 10 seeds are fatal. Then 15 to 20 gram of the root is fatal. Some 8 to 20 seeds, at least that much you remember. It will kill within few hours, 2 to 3 hours it can kill. Okay. Now coming to the clinical features. Clinical features of Cerebra thevetica. Basically we are looking at clinical features. Here there will be burning sensation in mouth, tingling of tongue, dryness of throat, vomiting, diarrhea, headache, dizziness, dilated pupils, drowsiness, loss of muscular power. Okay, what and all can you point out in this guy? Burning sensation in mouth, tingling of tongue, dryness of throat, vomiting, diarrhea, then headache, dizziness, dilated pupils. Okay, dilated pupils, drowsiness, he wants to sleep, loss of muscular power, rapid weak irregular pulse, hypotension, heart block, because it's something to do with heart. So there is heart block, collapse, and death can occur, guys. Obviously it's a cardiac poison, so death can occur due to peripheral circulatory failure. Now how will you treat this person who has taken this seeds or their Cerebra thevetia? Cerbera. Oh my God, I keep saying it wrong. Cerbera. So treatment for the Cerbera poisoning. Treatment for Cerbera poisoning will be gastric lavage, sodium lactate glucose to combat acidosis. So here they are giving sodium lactate. Nowhere we saw this actually till now in the treatment, right? Sodium lactate you can give as a treatment, and you can also give 5% glucose with it, okay, to combat acidosis. 1 milligram atropine, again atropine, adrenaline, noradrenaline, to counter heart block. This is called as BHIST regime, they are saying. So what is this BHIST regime? BHIST regime. So atropine plus adrenaline plus noradrenaline is BHIST, given for Cerbera thevetia. Okay. Now postmortem findings in these people. Postmortem findings in these people who have taken Cerbera thevetia. Postmortem findings will be something like signs of GI irritation. There will be GI irritation signs in the postmortem findings, remember. And congestion of stomach and duodenum. Stomach and duodenum will be congested, and visceral organs will be congested. Medico-legal importance of Cerbera thevetia poisoning will be, the medico-legal importance will be, come on, cooperate. Medico-legal importance of Cerbera thevetia is suicides are common, especially in villages. Homicides are rare. Accidental poisoning in case of overdose, when it is used as a remedy for venereal diseases that to reduce swellings, etc. So accidental poisoning, homicidal, suicidal. It is used again as cattle poison. Abortifacient. So it is used to cause abortion, maybe. Abortifacient. Okay. It is used as love filter. Increases attraction between giver and taker. Wow, what the hell is that? It can be used as a love filter. Increases attraction between giver and taker. Whatever the book is saying, I'm saying, that's all. Okay, this is about this one, that is Cerbera thevetia. Cerbera thevetia we have finished now. So here we are, Cerbera thevetia over. Now we have to go to Nerium odorum. Nerium odorum is this Kanagal Kaddi in our language. Basically, it is it is a cardiac poison, about which we have to know more now. All parts of the plant are poisonous. Array, nobody told me this. We used to grow this and take care of it so much. All parts of the plants are poisonous. The active principles are, so the name is Nerium odorum, correct? So if the name is Nerium odorum, then you will say Neriiodorin. Neriiodorin is the active principle. Neriiodorin. Oh my god, what is this? Rin and RIN, REIN. That is the only difference. Then carabin. Now how will you remember this? Nerium, Neriiodorin. Neriiodorin, Neriiodorin. Carabin. That's really difficult to remember, guys. Okay. So let's just look at fatal dose. Fatal dose of this plant is like 15 to 20 gram. Same thing, right? 15 to 20 gram or 5 to 15 leaves. Array, yeah. I didn't know taking 5 to 15 leaves of this plant will kill. We have so much of these plants. Okay, fatal period is 24 hours, within 24 hours. But imagine 24 hours is a long time of suffering. Okay. Then look at the clinical features of Nerium odorum poisoning. So contact dermatitis, local application, headache, dizziness, respiratory difficulty, nausea. Inhalation of flowers will cause nausea. I never tried this. I used to pluck these flowers every day when I was a kid. Vomiting, pain in abdomen, frothy salivation, difficulty in swallowing, articulation, restlessness, muscle twitching, tetanic spasm, lockjaw. Lockjaw, tetanic spasms. Okay, something different there. Then exhaustion, drowsiness, coma, respiratory paralysis, and death due to heart failure. Obviously, you have to write death because these are all cardiac poisons, correct? So finally, you will write respiratory paralysis, coma, death, all that you can write because these are cardiac poisons. Now, as a doctor, you should know the treatment to these cardiac poison, that is Nerium odorum. So, what is the treatment? Now, let us say this is so common and you will get cases with this poisoning. Then how will you treat? Treatment is same, gastric lavage, symptomatic treatment you will give. Anesthesia may be necessary. They are telling anesthesia first time here actually. Now, what will you find in postmortem findings if a person is dead because of this Nerium odorum poisoning? Then what will you see in his body? So this guy is a dead body now. No, non-specific, nothing specific. You will see the heart, because it's a cardiac poison. Petechial hemorrhages on heart. This is characteristic, so you have to write. Okay, petechial hemorrhages on the heart. Congestion of organs will be there. Medico-legal importance. What is the medico-legal importance of this Nerium odorum? Suicides are common in villages. Array, I didn't know only. Suicides are common in villages. Homicides are rare. Accidental poisoning in case of overdose. Again, same thing. When they were using it to treat something, they may accidentally have a poisoning. Cattle poison, abortifacient, love filter. Same thing we have written for all of these. So now we are done with Nerium odorum. In cardiac poisons, what and all we have finished so far? We have finished Aconite, we have finished Cerbera, thevetica, we have finished Nerium odorum, we have finished. Now we'll go to Digitalis purpura. Okay. So Digitalis purpura, it is this plant here. This is our Digitalis purpura. We are going to read about this now. Now, Digitalis purpura, it's also called as foxglove. Roots, leaves and seeds are poisonous. Roots, which are down, leaves here, and seeds which are inside these flowers are poisonous. So what are the active principles? Active principles are going to be digitoxin, digitalin, digitaline, and digitonin. My God, everything sounds same only. But isn't this same as, hold on, we have to confirm something, hold on. So guys, we just wanted a clarification and we kind of got this purpura. Okay, this is purple, right? This is the purpura. This is going to give the toxin, digitoxin. However, the one which we get digoxin, right? That is Digitalis lentana. So don't get confused. Okay, Digitalis purpura is different, Digitalis lentana is different. Purpura is going to give you the toxin, digitoxin, which is not used as medicine exactly. But the digoxin which is actually used, that is Digitalis, it is coming from Digitalis lentana. Okay. Now, we saw the active principles. Active principles, let's repeat. Active principles. Active principles, please give us the active principles. Active principles are digitoxin, digitalin, digitaline, and some digitonin. How will you remember? I don't know. Digitoxin, okay, you can write. Digitalis, digitoxin. Digitalin itself you can write. Digitalin, digitoxin, blah blah blah. Okay. Now we are studying about this plant, right? Now, what else you should know about it? Action in toxic doses. We're talking about the action of this thing. Action in toxic doses, it increases excitability of heart. So heart gets excited. Heart excitement increases, right? Excitement of heart with extra systoles by direct action on heart muscles. So direct action is there on heart muscles and extra systoles will be there. What will be there? Extra systoles will be there. Okay. I think it's better to give some space and write here. Okay. Fatal dose is Digitalis means 2 to 3 gram. Digoxin is 5 milligram. Digoxin is actually used as a drug, but it's very minute, 0.1 or something it is used. 5 milligram of digoxin is fatal. Actually, it is used in heart failure. So this is a cardiac glycoside, remember. So it is 5 milligram of digoxin is actually fatal. And it kills in 1 to 24 hours. It's quite some time to kill. Okay. Now let us look at clinical features of Digitalis purpura poisoning. Clinical features, please. Okay. Clinical features of Digitalis purpurea poisoning. Same thing you will write: nausea, vomiting, abdominal pain, burning sensation, diarrhea, bradycardia. Here it is bradycardia, remember. I'm not sure. Bradycardia it is telling. Extrasystoles will be there: ventricular tachycardia, fibrillation, atrial fibrillation, faintness, precordial oppression, heart block. So heart block. Headache, fatigue, confusion, anxiety, depression, disorientation, drowsiness, hallucination, delirium, everything to do with poison you can write. Then transient amblyopia, something to do with vision, blurring, photophobia, scotoma, diplopia, color aberration, urticaria, I have skin rashes, correct? Some urticaria, skin rashes, then death. You should write death in clinical features. Now coming to treatment of Digitalis purpurea poisoning: gastric lavage with tannic acid. You can use tannic acid and do gastric lavage. Activated charcoal used as universal antidote, obviously you know that. Purgatives, so that you can get out the poison if he has taken it orally, right? Atropine you can give. KCl, potassium chloride, why will you give? To reduce extrasystoles. Oh, to reduce extrasystoles you use potassium chloride. Then you can use lignocaine as a specific antidote for cardiac arrhythmias. Anti-digoxin antibodies. I like that. We have studied that, right, in digoxin chapter. Anti-digoxin antibodies. This is a specific antidote. This is the specific antidote. Then coming to post-mortem findings, there are no specific changes again. You cannot make out that it is because of this. You cannot see any specific change. In post-mortem, you will see that there is irritation of gastric mucosa, and probably you will find the leaves or seeds of Digitalis in the stomach. Now coming to medico-legal importance, same thing you will write: suicide, accident, homicide, then what and all those poisons, right? Accidental poisoning due to overdose or eating the leaves by mistake. Wow, be careful if you go into any farm like this. Don't take the leaves and eat. Homicidal poisoning is possible. Cumulative poison, that is a person may develop sudden poisoning if taken sublethal doses for prolonged time. So basically if he is prolongingly taking a lot of these drugs then prolonged time, as a cumulative poison he might die. So we are done with Cerbera. No, we are done with Aconite. We are done with Cerbera, thevetia, Nerium, odorum, Digitalis purpurea. Now last one we are going to Nicotiana-Debacle. Nicotiana-Debacle. Look at the spelling here. Nicotiana-Debacle. Okay. So now let's move to Nicotiana-Debacle. This is Nicotiana-Debacle, correct? So look at the flowers, how it is and all that. Nicotiana-Debacle. Now all the parts of this plant are poisonous except the ripe seeds, they are saying. Imagine in this one, Nerium also entire plant was poisonous. In this one also entire plant was poisonous. What is this? Cerbera thevetia. This is also poisonous. Only this one, they didn't mention the flower. They said only the seeds, leaves and root. Okay, Aconite root also entire plant is poisonous. So everything, whole plant is poisonous except for that Digitalis. Okay. So now let's move on to Nicotiana-Debacle. Nicotiana-Debacle. Now here also entire plant is poisonous except the ripe seeds. Except ripe seeds, remember, raw seeds are still poisonous, I think. Now active principles. Active principles, can you say active principles of Nicotiana-Debacle? Active principles will be, obviously, what will the active principles be? Active principles will be nicotine, right? It acts on the autonomic ganglia, stimulates initially, then it will depress and block. Then you have anabasine from nicotine plant. Then you have nornicotine. That will be easy to remember, right? Nornicotine will be easy to remember. Nicotine, nornicotine. Okay. Then some lobeline is there. If you want, you can remember. The fatal dose of nicotine that can kill is 60 to 100 mg. Then why they are using all this in cigarettes? I don't know. 60 to 100 mg of nicotine can kill within 5 to 15 minutes. Arey. Tobacco 15 to 30 gram can kill, but nicotine 60 to 100 mg, just milligrams, can kill within 5 to 15 minutes. Interesting. Now let us go to clinical features. Clinical features of Nicotiana-Debacle poisoning will be, now let us look at the cardiovascular system. Tachycardia followed by bradycardia, hypotension, arrhythmias, because obviously it is going to be a cardiac poison. Then respiratory system, there will be tachypnea, GIT irritation will be there, burning sensation, nausea, vomiting, abdominal pain, salivation, tobacco odor from mouth. What happens to central nervous system? Headache, same thing, confusion, vertigo, sweating, convulsions, coma. Same thing you will write, confusion, convulsions, coma. Now if there is chronic poisoning, some things are extra you have to write. If there is chronic poisoning, then you will see, if there is chronic poison of this Nicotiana-Debacle, then there will be anemia, palpitations, irregularity of heart, angina pectoris, Berger's disease. Then in respiratory system, cough, wheeze, dyspnea, chronic bronchitis, lung cancer. So obviously lung cancer, don't forget to write lung cancer, guys. This is what they put on the tobacco cigarette boxes, right? Then anorexia, vomiting, diarrhea. CNS chronic symptoms will be impaired memory, blindness, tremors, insomnia, anxiety and headache. How will you treat this Nicotiana-Debacle problem? How will you treat it? So treatment, again, gastric lavage, purgative, atropine, diazepam for convulsions, atropine to treat hypotension. Okay, that's all. Wherever there is hypotension, so Nicotiana-Debacle, that's what we were looking at, right? Just continuing here, Nicotiana-Debacle, we were looking at the treatment. So treatment we saw gastric lavage, purgatives, atropine, diazepam for convulsions. Atropine because to treat the hypotension, correct? Okay, then coming to postmortem findings in Nicotiana-Debacle. To find the postmortem findings. So postmortem findings will be like asphyxia, right? Asphyxia features brownish froth from mouth and nostrils. Guys, this you have to remember. This guy's mouth and nostrils will have brownish froth. Stomach may contain fragments of leaves or smell of tobacco can be there. That's all, guys. Nothing's important here. Then going to medico-legal importance of Nicotiana-Debacle poisoning. It is common drug of addiction. It's a drug of addiction. It's most commonly used substance in India, guys. Don't forget that. Write that also. Most commonly used substance in India. Accidental poisoning can be there because of ingestion. Excessive smoking. Application of leaves for juices to the wounds they can apply. Suicidal, homicidal are rare. Okay. So that is all we have studied in cardiac poisons. Okay. Just one word, let us take a recap. Nicotiana-Debacle causes hypotension, bradycardia. Correct? That's what we have confirmed, right? What about Digitalis purpurea? It also causes cardiac arrhythmia and it causes bradycardia. Correct. So that's why you can give atropine here also. Nerium odorum, what it will do to the heart? Heart, weak pulse, hypotension, same thing, right? Weak pulse, hypotension, same thing. Then Cerbera, right? Cerbera, thevetia. What will this cause to the heart? Heart block, collapse, circulatory failure. How will you treat? Again, atropine. Aconite also causes bradycardia, is it? Tachycardia followed by bradycardia and hypotension. Again, here also you will give atropine. So you can remember that atropine will work as an antidote for all of these. Okay. For the cerebra, thevetia, they gave atropine plus adrenaline plus noradrenaline. That is called as Behist regime. For aconite, they'll give atropine. For aconite, they'll give atropine, digitalis, lidocaine, procainamide, phenytoin, and oxygen obviously for everything they'll give. Cerbera, thevetia, they'll give atropine, adrenaline, noradrenaline, sodium lactate, glucose. For Nerium odorum, they will give what? For Nerium odorum, they will give gastric lavage, anesthesia, symptomatic treatment only they wrote. Nothing specific they wrote for Nerium odorum. For Digitalis purpurea, they are giving KCl, atropine, lignocaine, anti-digoxin antibody. Anti-digoxin antibody you should not forget because it's Digitalis anti-digoxin antibody. Nicotiana-Debacle, you will give atropine and diazepam. Diazepam also you write everywhere, okay? There will be convulsions, right? Write diazepam also. So that's all for now in cardiac poison. We have finished all the 5 cardiac poisons. That's all for now from our side. Bye.